Okay, today we are going to discuss about the spherical ametropia and correction of spherical ametropia is strongly on the basis of optics, not otherwise, not clinical tips and all these things. So we are not going to talk about astigmatism, definitely not. So we are going to talk about myopia and hyperopia. This will be very simple topic. This will be very easy topic, and we already have learned it about when we are in age of we're in class of 8th class or 9th class. I don't know. So let's start. But very tricky and very important point in this video is how to correct the spherical ametropia, especially in the viewpoint of optics, which is very crucial. Okay, so in this presentation, we are going to use this reduced eye system, which only consists only one single refracting surface. This is the single, which is lens plus cornea, definitely. And axial length we consider in this case is reduced 22.22, and which is definitely secondary focal point, and primary focal point in this case is 16.67, and you know why minus, because against the light direction. And primary and secondary principal line is same, coincide with cornea. This is refractive index we consider 1, and the refractive index of the eye total we consider 1.33. This is basically reduced eye system, and I hope we will discuss later on in other presentation about the reduced eye system. We will definitely learn about Goldstein schematic eye, definitely. So let's move. We will use this eye model for the rest of our presentation. So this is the normal eye, which is imetropic eye. When the accommodation is at relax, then from infinity, which is definitely far point, from very far light hits the eye and it focuses on the retina, isn't it? That's definitely a normal eye. And in this slide, I want to discuss about the far point. So whenever we discuss about the far point, you have to understand the far point means the maximum distance at which eye can see when it is uncorrected, or when it is uncorrected, or maybe we use of accommodation. Sometimes in case of hyperopia they use accommodation for the far point, and in case of myopia they cannot use accommodation. If they use accommodation, then the far point comes closer to the eye because it will do reverse work. So far point means, sometimes people get confused, especially optometry student get confused, that far point we should know that conjugate point, the concept of conjugate point. Because let's see example of this lens. Light comes from parallel, from distance, and hit and focuses here. Okay, so then infinity is one thing, and this secondary focal point of light is another thing, isn't it? But this both point are conjugate point. If we switch, if you send light from here, if you send light from here, it come to the focus. If we send light from here, then it goes parallel. So the infinity and the secondary focal point are conjugate point. They come to each other in the, exactly, we can switch the places, and it doesn't matter if we switch the places, then image is like simply like this. Light comes from here, and reverse direction it goes to here. So you have to understand the concept, the far point. Far point, one far point we can explain in environment outside of the eye, which is the distance outside of the eye, and another far point we can tell inside of the eye. So in this point of view, far point can be at the retina, far point can be in front of the retina, far point can be behind the eyeball, isn't it? So this point of view is very important when we are trying to discuss myopia and hyperopia with different terms and conditions. So let's explain myopia, then you will know. So in case of myopia, we can tell from different ideas. Let's see. One point of view, we can tell that far point is not at the retina, but where is between retina and the lens, or between in front of the retina, isn't it? This far point is in front of the retina. At the same point, same term, we can tell far point is behind the retina, then it is hyperopia, isn't it? One point. Another point, the far point of the myopia is always at a finite distance, is always at the environment at a finite distance, no matter what. Let's take an example. If someone is minus 2 diopter hyperopic, myopic, sorry, minus 2 diopter myopic, then he must be far point, it must be 50 centimeter, isn't it? 1 divided by 2 is 50 centimeter. If he is 5 diopter hyperopic, then far point must be a 20 centimeter, isn't it? But 20 centimeter and 50 centimeter is a finite distance, is it's like between his eye and the infinity. For example, if someone is minus 1 diopter myopic, then his far point is 100 centimeters, which is 1 meter, which is definitely between his eye and the infinity, which is far point is at finite distance. You can calculate that distance, you can find that distance, isn't it? It's not a virtual distance, it's a real distance. So in case of myopia, you can define myopia by many terms. So the basic myopia definition is when the light comes from infinity, it hits the eye, and it with accommodation it rests, and and that focuses in front of the retina, which is this. Another fancy way, or another easy way to tell is the far point at infinity. In other refractive errors like hyperopia, far point is not at infinity; it's beyond the infinity. So far point is at infinity. It's always happening in myopia. So simple. There is nothing happening there. So we can tell other point of view. Far point is in front of the eye. So we can tell far point here and we can tell far point here. Both are same thing. So far point is in front of the eye, or far point is in front of the retina, or far point is at a finite distance. Both are same thing. So both are we can tell them that's myopia. So why myopia occurs? Because the disbalance between two things. What? One is the refractive element. Refractive elements means power of cornea and lens. If power of the cornea and lens together is maybe greater than the axial length, isn't it? So that disbalance should be there. What I mean is the power refractive element means the power that has is cornea plus lens. So cornea plus lens has greater power than the axial length match. For example, if 60 diopter power exactly matches with 24 axial length, for example, axial length, then if any person have 64 diopters with same axial length, then it will be problematic, it will create myopia definitely. If someone has 64 diopter at the same time have maybe, let's discuss 23 of axial length, then it could be ametropic, isn't it? So it's just disbalance between two things, the axial length and the refractive component. We can see a lot of, I have seen a lot of patients, like I'll tell you, I have seen cases of a refractive element has power of around of total 55, but at the same time they have what, they have axial length of a larger axial length, isn't it? A larger axial length. So then it will create a balance between two things, and then it is not an refractive error of myopia. So it's simply that you have to understand the concept that it is the balance between refractive component, which is cornea and lens, and the axial length component. Yes, definitely the distance between cornea and lens matters, but we will discuss these things in coming presentations, in something like that, immetropization and all these things. Let's focus on today's topic and how we gonna correct these things, correct the myopia optically. I'm talking about optically. This is the basis of subjective refraction, isn't it? So basically, if this eye has refractive error of 2.59 diopter, then we put 2.59 diopter power in front of the eye, in, let's say it's a contact lens form. Then what happens if light coming from infinity, basically infinity, diverges here, isn't it? Diverges here, and that diversion is so suitable that cornea refract it and focuses it into the exactly retina, exactly fovea. Then what is the principle? See, this is the principle which is central important, that the secondary focal point of this lens exactly matches with the far point of an eye. This should be happen, otherwise there is no refractive correction exact. It is necessary in case of myopia, it is necessary in case of hypopia. And we know that for myopia, secondary focal point lies here, primary focal point lies here, isn't it? It's just different than plus lens. So this is primary focal point, this is secondary focal point. And at the same time, in case of myopia, far point lies in front of the eye. So this lens secondary focal point f dash should match to the far point of an eye, far point of an eye. And at that condition, refractive error correction happens. And this is the basis of subjective refraction. It's very basis of subjective refraction. And the same thing I am going to explain about hyperopia. So let's discuss. To correct the myopia, the secondary focal point of a minus correcting lens must be coincide with the far point of an eye. This is the golden rule. You have to understand this point so that you understand the subjective refraction and principle of subjective refraction. When this is the case, the infinity distance object imaged on the far point, since the far point is a conjugate point to the retina, image is focused, isn't it? The infinity is conjugate with the secondary focal point of an secondary focal point of a lens, isn't it? Correcting lens. And the secondary focal point is conjugate with the far point of a lens. So indirectly, infinity conjugate with the far point, and then we can see infinity. This is the case. You have to understand. Infinity conjugate with the secondary focal point of a minus lens, and secondary focal point of a minus lens conjugate with the far point of an eye. And indirectly, far point is conjugate with infinity. So that's why infinity is conjugate with far point, and we can see distance. This is the basis of optics in case of correcting refractive error. Okay, and now hyperopia, as we know that hyperopia, we can tell the far point is behind the eye, isn't it? Far point is behind the eye, it's virtual refractive error, or we can tell that secondary focal point is behind the eye, not exactly at the eye, which is ametropic, in front of the eye, secondary focal point, which is myopic, and behind the eye, which is hyperopic. So in case of hyperopia, it's very simple. It's very simple. See, we put plus lens. Plus lens is always has, as I said earlier, plus lens always has is primary focal point and is secondary focal point. The plus lens has secondary focal point, and that secondary focal point should match with the far point of an eye, isn't it? And that's exactly the principle. So to correct hyperopia, the secondary focal point of a positive correcting lens must coincide with the eye's far point. This is the golden rule. You have to understand this rule. When this is the case, an infinity distance object is imaged at the far point, since the far point is conjugate with the retina and image is focused on the retina. Again, I said infinity conjugate with secondary focal point of a plus lens. Secondary focal point of a plus lens conjugate with far point. And that's why indirectly infinity conjugate with far point and patient can see far distance. This is the optical basis of refractive error corrections, or what do you say, subjective refraction. This is the optical basis of subjective refraction. You have to understand as an optometrist student. So in conclusion, we discussed about this refractive error, different way of defining refractive error, not just defining a parallel rays come from the infinity and all these things. You can define from far point of view. You can define between this balance of refractive element of eye and axial length, isn't it? You can discuss that. And we have discussed this correction optics of ametropia, isn't it? We have discussed this infinity conjugate with secondary focal point of a glass, or if correcting a lens, secondary focal point of a glass conjugate with far point, and indirectly infinity conjugate with far point, and pattern can see. So this is the concept of correction, optically correction of refractive error, especially spherical refractive error. And this is the book that I have discussed today. All the things I have discussed, all the things from this book. This is a very good book to start optics for optometry as an optometry student. And I have told you that another two book teaching and from George SMLE professor, that geometrical optics. These are great books that you can read and understand the optics. So I hope this is it. Please comment if you want another video. Thank you.